Good morning and welcome to City Talk. It's a weekly radio program. It's a podcast. It's a TV program. We're here at the city of Waco. We're able to communicate the great things happening in Waco. I'm Larry Holsey, and I'm your host today, and I'd like to welcome today LaShonda Malrey-Horne, who is our new director of our Waco-McLennan County Public Health District. LaShonda, welcome to the program.
Thank you, Larry.
Well, you come from the East Texas area, and this is something you've done some actually different type of job compared to being a director of a department. We're going to talk about that. I want you to, first of all, tell us a little bit about you. I think you grew up in the East Texas area. So I know a lot of East Texas girls that were really good, and you've got such a personality. I just want the people to learn about our new director of the health district. Tell us about your background.
Well, thank you so much, Larry, for such a warm welcome here to the city. You've been great since I've met you, and I'm excited for your retirement, but a little bit disappointed because we won't get to work together often. I am from East Texas. I was born in Longview in Gregg County, but raised in Kilgore, which is also in Gregg County, and I went to high school at what they now call Gladewater Sabine High School because technically the school is in the Gladewater address, I guess, but it's in a little community called Liberty City. I have three older sisters, Sonia, Yolanda, and Tracy, and we all went to Sabine, and my dad still lives in the house that we grew up in, and the sister right over me, Tracy, actually lives there with him and her two boys, so they're getting a chance to experience Sabine.
So you get to actually go home for holidays and things, and home is
literally home.
Yeah, and that's not always the case.
Yeah, so we get a chance to spend time there at our childhood home often, and it's great to be close to family, but I was excited about an opportunity to come out here to Waco and try something different.
Well, take us through your professional, your higher education. You talked about high school. Let's go on to your background, your education, because you've got a very varied and very strong background that brings you to the leadership position here in the city.
So I went to college to undergrad at Texas Woman's University in Denton, and I majored in community health or health studies, and then I got my graduate degree in public health, a master's degree in public health from A.T. Still University, which is in Kirksville, Missouri. It was an online program, but it was extremely intensive because I prefer to be one-on-one and in person, so I had kind of a tough time going through that, but I was able to finish it up. And during that time, I really started getting interested in how to be a health educator in a more impactful way and really impact policy and environmental changes, especially around the built environment. So I became very interested in that kind of thing. I actually got interested in public health because the summer of my freshman year of college, I had a case of tuberculosis. I really don't know where I got that TB from, but I'd spent some time in Denton, some time in the Los Angeles area with my oldest sister at the time, and by the time I made it back to East Texas, I had TB. So I got a chance to spend 12 days in the hospital learning all about infectious diseases, trying to figure out how to diagnose them. And I worked with a wonderful pulmonologist through that process. And during that time, I was a nursing major. When I first went to college, I was a nursing major. So my DOT nurse, her name was Celia, she was the director of the public health lab of East Texas, and she lived close by our house. That's why she would bring me my meds. And once I wasn't infectious or contagious anymore, she invited me to go to a nursing education event that was all about TB. And that's where I learned about public health. And I fell in love with it and realized that there was a different side of healthcare and medicine that didn't include taking care of the sick patient, but really about prevention, policy development, and trying to make things easy for communities. So one of my taglines is make the healthy choice the easy choice for the population you're working with, because I think that's really important.
Well, you need to copyright that if you hadn't already and get that going.
I don't know if I can copyright it because I kind of stole it.
But
so.
It definitely speaks to health and what the health district is really all about.
For sure, yeah.
It is. Well, your background is very varied. You mentioned the nursing student part of it, and so you've had hands-on, and having tuberculosis is really a traumatic thing, but brings it home personally when you've experienced it. It's not just always learning about it at school or talking about it or even administering with it, but having had it.
Yes.
You now know the seriousness of it and the byproducts or whatever else, and that's an education in itself.
It sure is. And also, my mother had her first heart attack, the first of 5, when I was a freshman in college as well. It was during that time that I was home when she had that first heart attack. And it it really just kind of doubled down on my interest in community and public and preventive health, because I knew that if she would have stopped smoking at an early age, taken a little bit better care of herself, really leaned into exercising a little bit, and not just giving of herself and actually, doing some of that for herself, she probably could have lived a few more years. So being a health educator at heart and enjoying health education, I spent a lot of her last years of life trying to convince her to make some lifestyle changes. And she did make some eventually, but she passed away a little over 6 years ago. And heart disease is something that I know runs endemic in Black communities, and 137 Black women die every day from heart disease. So that's one of the things that I really spend a lot of time focusing on, trying to improve that disparity in that health outcome for Black women.
And I know you've identified that as one of your passions.
It is.
And you have a reason, justifiable reason. And we'll talk a little bit more about that later on in the program. But, the inequalities as it may be on education, and letting people know there are ways to improve your life expectancy,
for sure,
longevity, and those type of things by doing the right things and getting into the community that you're talking about. And we'll talk a little bit later on that you have a passion for. Now, talk to us about your professional career, because you were, when you came to the city, you came from a regional health care, not a public health district like what you're in now.
Yeah.
But the regional, I believe, had 35 counties or something?
It did. So prior to coming here, I was the communicable disease program manager for Public Health Region 405 North with DSHS, and it includes the 35 counties in Northeast Texas. So our region reached all the way up to the Oklahoma border, all the way over to the Louisiana border, and as far south as Deweyville, which is about 10 or 15 minutes north of Orange, Texas, to give you some insight, and then over toward the Dallas area, but kind of stopped in Van Zandt County. So it was a huge region, and from top to bottom, the travel time would be about 4.5 to 5 hours. So we spent a lot of time on the road. I really enjoyed working in Region 405 North because Northeast Texas is home. All the people are the same everywhere, even though you might be in a different area. But it was just a great experience to work with those 4 programs: immunizations, zoonosis control, tuberculosis elimination, and HIV/STD, to try to provide some of those critical services to communities in deep East Texas. So what would happen is, in any area that didn't have a local health district, the regional health department served as the local health department. So I, along with a team of people across the region, we had field offices. Our regional medical director, Dr. Sharon Huff, was the local health authority for about 20 counties.
Wow.
And so between trying to manage just day-to-day basis, and then we layered COVID on top of it, it got pretty exciting last spring. But we had a great time learning and working together and helping the county judges and the local municipalities work through their COVID response.
Wow, that's huge. Now, that was the regional network and everything you're with Texas Department of State Health Services.
Yes, sir.
And we've all heard that comment, TDHS, Texas Department of State Health Services. That's where the authority comes for local health districts as well. So you've kind of been in the statewide area, so you've got experience working with them, and you probably have some friends and contacts that we're going to benefit from, and that's and especially in those areas. So that's great to know. So you did that for like 4 years?
4.5 years. I was with DSHS, and prior to that, I worked at the University of Texas Health Science Center at Tyler in the Department of Occupational Health and Preventive Medicine. So I worked with the wonderful physician named Dr. Jeff Levine, who was the senior vice president provost of the university system, and we did a lot of research-based projects. He has a pretty big ongoing project called the Southwest Center for Agricultural Injury and Prevention and Safety. So I helped him with some ad center stuff. I worked on residency training programs with him, just a few other projects. And most recently, one of my last big projects at the health center was to help create the School of Rural and Community Health that now offers a master's degree in public health. So I was able to help recruit faculty for that program and kind of build the plan and work with the UT system to get that going, and Dr. David Lakey to make things happen. So that was a pretty big project. It was fun, though, so to see that come together. I've
always heard great things coming out of East Texas overall, the medical community in the Tyler area and all that. is just really, and so great that you were a part of that and probably contributed and made it even better than what it was.
I hope I did.
Now let's shift a little bit to COVID. I mean, COVID changed everybody's perspective, in the health community especially. So in your East Texas experience with the Texas Department of State Health Services, describe to us what happened when it was announced and everything in y'all's area, and then maybe do a little parallel and say what you've heard about how it was here. How was the situation there compared to here, and how was it handled maybe in different ways?
The main difference between the response that the health district here had and what we had in our regional medical operations center is that we were responding for about 25 counties, and the health district here was responding for 1 county. The counties that we were responding for didn't even include the county that our office was in.
Oh, really?
So that was kind of interesting because the Northeast Texas Public Health District was responsible for Smith County, and our office is in Smith County, a matter of 2 miles from NetHealth's office, but we weren't even responding to what was happening right there at home. We were really working on what was happening within the region. However, at the beginning, there was limited COVID testing. So our regional epidemiologist, January Smith, worked very closely with the Public Health Lab of East Texas and made sure that anyone that was getting tested really needed to be tested. So we were the clearinghouse for all testing. Any PUIs or people under investigation or people under monitoring would come through our call center that we stood up. I got in on the front end of the response, well, I'll say about 3 weeks into the response as the operations section manager, section chief, and that was really just to kind of get the response organized. We had great epidemiology staff, great preparedness staff, but Dr. Hope was like, now we got to get this thing organized. So I feel like one of my strengths is just I'm able to take things that are all over the place and kind of push them together and make them work in a straight line. I have pretty good organizational skills, so I spent a lot of time the first few weeks of the response just looking at what was happening and trying to figure out how to get a plan in place to get us some flow. We recruited some contract staff to help get things going because most public health departments, whether they were local, regional, state, however, were grossly understaffed, especially with epidemiologists. And this was an epidemiology response from the beginning. So we had to get some staff in place and just try to figure out how to go and wait and see what happened at every news conference and shift gears as things changed. And we've been doing that ever since. And I'm sure Stephanie and Vidahi were doing the same thing here locally. And so where we were all kind of doing the same task in the response, counting case counts, making sure people were getting tested, trying to stand up testing sites. It was just a bigger span or a broader response at the regional level because we had more counties. Not to diminish what was happening here because they did a great job. I'm lucky that I walked into a health district with such competent and capable staff. They've done a great job here.
Well, obviously, COVID has been a challenge for everybody. There's no question about it. And there's different proportionalities, as it may be, the way the testing facilities were diverse, were distributed, and all that. And everybody responded in I'm sure, a very overall professional manner.
Yes.
And you're being in the experience that you background with communicable diseases and things like that, that fell right into the thing that involved with the COVID and everything else.
For sure.
So you've been here now since March the 1st, basically 3 weeks, 2 weeks, something like that. What are your overall impressions, first of all, of the health district? Not specific to COVID right now, but just overall the staffing and the response that you felt.
This health district this health district has a lot of opportunity to grow. We're a sleeping giant. I can't wait till we get past COVID so we can see all the things that can come out of the health district. All the leadership, the department leaders, the managers, the supervisors, they've been great, very responsive to any request I've had. I've had a chance to meet most of the staff. They all seem excited about the work they do. They've all welcomed me with open arms. So I don't know if that's just because it's a new boss in town and we're going to be sweet to her until she makes us mad. But they all have been wonderful. So I really feel like we're just ready to grow once we get COVID kind of tucked away, or at least at a place where we can manage it. Since we are transitioning to a vaccine response, response, we're going to be asking staff to do some work that might not normally be their everyday work. We're going to be doing some quality assurance type work to make sure that our clinics are effective and fast and, no errors. So we'll be looking at the data. Some of our staff will be asked to work with EPI to look at the data in a different way. We'll be starting to make sure we're doing equitable vaccine distribution, reaching out to communities that aren't getting vaccinated at this point that really need to be vaccinated. So we've got a lot of work to do, but I'm excited and I'm glad to be here. I feel like it's a great health district. I couldn't ask for a better place to be. And the support I've received from Deputy City Manager Deidre Emerson and even Bradley Ford, our city manager, has been great.
If you just joined us, we're visiting with LaShonda Malrey-Horne. I get that a little confused every once in a while. And if you're not able to see this on the TV, you need to watch it because her personality is just vibrant and just a face of a very loving, caring, and energized person. And that's just. And you were talking about that just a minute ago. And when you take a look at you're alive with it. And we're excited to have you here. You mentioned the whole COVID response and that type of thing. We're now at the vaccination stage, you mentioned. Okay. Tell us what you know or what you feel like because everybody's always interested week to week where we are. I mean, we heard about Johnson & Johnson now coming out, and of course we've had Pfizer and Moderna and all those other ones. Where are we? We're still at this stage doing 3 days a week type of a vaccination. What do you either know or do you feel like will be as this whole thing escalates, as we hear from the federal people and state and everybody else? Mm-hmm. Where do you think the vaccination, and I'm going to continue my long stretched out question. Mm-hmm. We're already at the 1C category, so we're for 1A, 1B for a long time. We're now at 1C in teachers. Mm-hmm. Kind of bring us up to date where you feel like the vaccination part of this is at.
So our efforts are going to move forward. At this point, we're going to continue to run the mass clinic at the McLennan Stadium for at least the next week or two. And then at that point, we want to start transitioning to moving the vaccine efforts from one central location to multiple locations across the county throughout the next few weeks. So we ought to see that start happening in the last week of March and into the month of April, where we take the vaccine to the folks. So instead of having people come over there and wait in line and do that big process, we'll be taking about 6 to 10 staff to churches, to community centers, to some of our parks and rec sites, to some senior centers, and we'll be offering vaccine on site there for about 4-hour blocks of time. They'll still be able to go to covidwaco.com to do the registration process to get an appointment, but they'll have to make sure they pay really close attention to the location of where they're registering for, because we will be offering multiple vaccination sites across the city over the next, hopefully starting in April. So it won't be just that big clinic at McLean. That kind of clinic is very labor intensive. It takes a lot of people to pull that off, and the staff work really, really hard. And I think they deserve to pull back from that, because that's a pretty tough one to do. So we will be taking the vaccine out. We're going to work with some of our community partners. First off, we'll work with Meals on Wheels to do a clinic for some senior adults. As we move into trying to get the 1C population vaccinated, we'll be able to expand to different locations that will capture more adults age 50 and older. And as you probably heard on the news, President Biden wants every adult to have access to a vaccine by May. So if that becomes a possibility, we'll work with even more partner organizations. We've already established a really good relationship with Ascension Providence and Baylor Scott and White to coordinate efforts in the family health. We just talked about this in Waco Family Medicine to make sure that we're all making our efforts very targeted. So we'll keep having conversations with them to make sure we target the vaccine response.
A minute ago, you mentioned Deidre Emerson, because it's really interesting the fact that when COVID pretty much began, we did not have a director of the public health district. And Deputy City Manager Deidre Emerson stepped in and did a marvelous job of not only what she was already doing, but running the health district and overseeing the health district during some really tough times. So that's kudos to her again.
For sure.
And where she had no I don't think she had any real health district management skills, but that shows not only her ability, but then the staff's ability to deal with and work together, and that's a great compliment. And so I just want to be sure overall that type of thing. Give us now your overall. You mentioned the Waco Family
Medicine.
Medical Medicine. I'm like, well, I've been here a long time, and I've called them Family Health Center for a long time. You don't have any excuse. What is your overall impression of our medical community? Because we're blessed to have two hospitals and a very great, talk a little bit about that and any future partnerships that might need to be increased.
I think the collaborative effort that's already established just through the COVID process, or what has grown through the COVID process, is great for this community. There's not competition in healthcare. It's not that Providence has to do it, or Hillcrest has to do it, or the health district has to do it, or Waco Family Medicine has to do it. We all are doing it together. So I told Dr. Grids during my interview process that the things that they do at Waco Family Medicine, we don't do. So, and what we do, they don't do. So we need to work together to make sure all of their patients and all of our clients have access to what they need. The same thing goes for the two hospitals. We should just be all working together in a network. I feel like it's a strong medical community. From what I've seen, there's some good partnership already developed, and I hope to be able to continue those partnerships as we move forward.
Absolutely. And I think, sad as it is, years ago, it was always not quite that communicable as it may be. There was quite a bit of competition because you had Ascension Providence and Baylor Scott and White, and those two, they're in competition with one another. But I think you're right. And COVID maybe has helped strengthen that because we're all working on the same cause, the same problem, and dealing with a lot of the resources and things we have to do. So it's really that. Let's get to part of what I know is a passion for you, and you've talked about it because you lost your mom because of heart disease, maybe, and preventable things, and anything that we can do to prevent, even when it comes to crime and things like that. I know the police department is very dedicated in trying to do crime prevention. Not going investigating criminal activity, but trying to prevent it. With the health district, similar thing. Maybe it's a long term, but it's a learned experience. Good diet and some of those kind of things. Talk about the things that you feel like are important and your passion as it is in identifying the fact that the Black community, the Hispanic community, and specific zip codes in our area
for sure
have targeted and had found results that it's unacceptable that we need to concentrate on. Talk about that.
So our plan is to take the needs assessment that was done a few years ago. I believe it was in 2019. Look at that needs assessment, and then based on what was found in the needs assessment, get ready for a 2021 needs assessment, or 2022 probably, because COVID's going to maybe throw us off a little bit, and make sure that we're doing targeted, data-driven, evidence-based programming to try to change some of those health outcomes. Personal passion of mine is walking, and I look forward to, as we move into the spring and summer months, to offer some walk-in talks, not just with our staff, but even with community members. I'm an organizer with the organization called Girl Trek. It's a national nonprofit that has encouraged over 1 million Black women to take a pledge to walk 30 minutes a day for self-care. You can learn more about Girl Trek at www.girltrek.org. And you can also find a wonderful TED Talk done by the co-founders of Girl Trek, Morgan Dixon and Vanessa Garrison, all about the epidemic that is heart disease in the Black community. So I'm hoping that as we move forward into the next year, especially as we open back up a little bit more, I can host some walk and talks with community members, community leaders, just ladies in those zip codes and even men in those zip codes. Hopefully we can partner with our new chief of police and figure out a way to make our city walkable and safe, and make sure the residents feel like they can walk safely. There's just a whole lot of opportunity. I feel like Waco is a sleeping giant, and I'm glad to be here as this giant wakes up.
Well, and the giant will wake up in a lot of ways externally as well. I mean, you're probably familiar with all the tourism and things like that. And our tourism numbers are continuing to grow back again. And that brings some challenges, not specific for our citizens, it is, but bringing in some potential communicable diseases and things like, just as you mentioned on your trip when you went to California and back and forth, and you came back with TB and you didn't know where it was. But those are things that are of interest. But working with other departments. You mentioned about the new police chief. Obviously, we're going to have her on in a couple of weeks. We're excited to have her be a part of our community. Talk about how the health district you feel like can maybe work better cohesively with the other departments of the city of Waco.
So we've already started working on a collaborative effort between our community health division and the Parks and Recreation Department to do kind of a little fun activity in the next few weeks around sidewalk chalk. Health districts and health departments go hand in hand with Parks and Recreation. I hope they'll be our best partners. We're on the same floor over there on the second floor of the municipal court building, so I need Jonathan and I to start putting our heads together and figuring out how to do some stuff that will really impact those neighborhoods that really need the impact. I will work with anybody that wants to work with us. I'm open. I feel like we can't do work in a silo. If we work in a silo, we never get the things done. If everybody is working toward equitable and inclusive programming across the city, we make our community as a whole better.
Absolutely. A few other questions maybe. Following COVID, what other things, let's say we didn't even have COVID, and when you were coming in now and to the health district, and what are other things that you see that we need to maybe ramp up and increase protection and things? You mentioned heart disease and some of the things about the zip codes and whatever. What other things maybe do you see?
So some of the things that we're going to work on, even in the midst of COVID, is we're going to try to improve our maternal and infant and maternal child health program. We have some staff there that have established a coalition, so we'll keep pushing that effort forward. We want to revise and revamp our community health worker program to make sure we're partnering with Waco Family Medicine to do community health worker services for their patients and clients. We'll also be doing some chronic disease self-management projects to really offer some diabetes education to our Black and Hispanic communities specifically, but not just limited to, and that's because of the disparities in the data that we see. Black and Hispanic patients that are diabetic are less likely to receive certified diabetes education services because there aren't many diabetes educators that are Black and Hispanic. So we're going to probably do some virtual classes where we can get some diabetes educators from other areas that are representative of our community to do those services via Zoom or Teams or whatever the platform may be. So we have a few things that we're already working on. One thing I can't wait to see is us get our WIC bus on the move, where we're taking WIC all around the county to make sure that our pregnant mothers have access to the WIC services, and they don't necessarily have to come to us. We definitely want to put that WIC bus on the road because it's pretty cool. So. Absolutely.
Well, real quickly, about a minute or so left. I know that we just finished not too long ago a community health needs assessment. What do you think you're going to be able to pull from that? Have you had a chance to look at any of those?
I haven't had a chance to look at it much. I glanced through it even during my recruitment process to kind of get an idea of what is, but I have looked at some of our Robert Wood Johnson Foundation data that they compile for counties across the country, and it's in line with what's in the needs assessment. So we'll use the data to drive our program, and we won't be pulling at straws. We'll make sure we're targeted and see what happens. We're excited.
Absolutely. LaShonda Malrey-Horne is our new director of our Waco McLennan County Public Health District, has been our guest on City Talk. LaShonda, I just really can't tell you enough about how your energy just exudes right away just by being in the room with you. And even though we're doing social distancing here in the studio, we're just so excited to have you here. And I know you're bringing not only great experience with the Texas Department of State Health Services, but also from the health district. And you're going to be I just think you're going to be a great success. And we are so thankful that you're here and look forward to watching what you do and changing our health district. Thanks for being with us this morning.
Thank you for having me, Larry.
And I want to thank all of you all for watching and viewing, and we hope you'll join us again next week for more information about the City of Waco here on City Talk. This program is produced by the Municipal Information Department of the City of Waco and is provided as a public service by this station.